This is a 16-year-old girl with a scoliosis, which is a curvature of the spine. And we heard that there was this girl in the Bahamas who did not have insurance. She comes from a very tight-knit community, and they're all kind of trying to get some things together to get her over here to have a scoliosis surgery, which is something, unfortunately, she needs based on the size of this curvature. And once we heard about this girl and pictures were sent to us, this is a problem that in the United States is sort of a quick fix, something that we see routinely, and we take care of routinely, and unfortunately, in some developing nations, they don't have the means by which to fix these problems, and it's really a shame. And once we heard that this was going on, and we said, well, how can we help? We started talking to some of the local institutions here in South Florida, and we were able to partner up with one of the hospitals who was donating some of their services. We spoke to some of the device manufacturers, and DePuy Synthes Spine has donated some of their instrumentation, their screws and rods, so that we can do the surgery. We spoke to an anesthesia group who's going to help us out as well as pediatrics who are going to do some medical clearance for us. And everybody, once they heard Leandra's story, they decided, we have to get on board, and everybody wants to really help her out. And so we really put together a first-rate team to help Leandra and bring her over here and do the surgery for her. In the operating room, it's going to be myself doing the surgery, and I'll be assisted by my partner, Dr. Cal Blumberg. When I see a kid like Leandra, and I see a problem that I know that I've corrected hundreds of these over my life, and this is something that we can really do fairly easily in this country. And I hear a story like Leandra's where she's in a small community where they don't have the means to help her out. This to me is payment enough. When I see a smile from her, or if I get a hug from her, or 6 months from now or a year from now when she comes back to see me and she tells me she's feeling great, that's the reward, that's the payment, and that's why I went into this, and it's why I continue to do it every day. Leandra, hi, this is Dr. Hirschman. How are you?
I'm fine, thank you.
So Leandra, I've got some great news for you. After months of talking to various different people and places, I think we're going to be able to get you over here and do your surgery.
Thank you. I'm very pleased to hear that. I appreciate that great.
Play any sports?
Yes, sir. Well, I play basketball, I do track, and I also play volleyball.
We got to get you back to doing all the stuff that you enjoy.
Yes, sir.
How about the end of June? Does that sound okay?
Yes, sir.
And we'll have you come in on a Monday, and we'll be able to fix you up by Thursday. How's that sound?
That sounds great.
Great. Leandra, can I speak to your father for a moment?
Yeah, hold on. Hello?
Mr. Rolle, it's Dr. Hirschman. How are you?
Pretty good yourself, sir?
I'm doing well. Thank you for asking. I just want to let you know that we are very excited to bring Leandra over here and take care of her. We're going to take excellent care of her, I promise.
This is the best news I've had all year, man. She's all smiles,